And thank you so much for joining us for our press conference on this Thursday. Today, Mayor Jerry L. Demings will discuss all things vaccination related, including the partnership with our federal and state partners. We will also discuss some attaboys that we are receiving from our citizens on the good job that is taking place regarding vaccinations. And the mayor will also have information on our emergency rental assistance program. Mayor Buddy Dyer could not be here with us today, sends his apologies. But Alvina Chu from the Florida Department of Health in Orange County is here to discuss COVID and vaccination trending in our area. We begin with Mayor Demings. Mayor?
Thank you, Dr. Williamson. Good afternoon to all of you. This week, a lot has really been going on in our community as we have seen the supply or inventory of vaccine increase significantly. Of course, the federal sites are now up and running, and we're still continuing to provide both testing and vaccines at the Orange County Convention Center. And so with the recent directive that came from the president and the fact that Governor DeSantis had an executive order created a little bit of confusion, I think, in our community about who was eligible and where you could go and whether or not you needed appointments. But we're going to try to clarify some of that today. One of the areas of confusion is the requirements for the medically vulnerable, those under the age of 65 who may qualify for the vaccine under the governor's executive order. First, let me just kind of tell you about what is going to be required. First, you must have a completed Department of Health form if you are extremely medically vulnerable. Again, that form is to be assigned or completed by your physician, your personal physician. This form can also be found on our webpage at ocfl.net/vaccine if you want to take a look at it and make certain that it is available to your physician. They should have them, but I'm just sharing this information with you as well. You need to have the form if you're going to go to one of the sites if you fall in the category of someone who is under 65 and medically vulnerable. If you're 65 or older, you don't really need the form. You can just sign up or show up as long as you have appropriate identification. Some of you have asked about bringing a doctor's note, but a note may not contain or provide the same information as what is required on the state form. So your doctor's note may not be compliant, so it is best to get the state form. Another major question is where to get the vaccine if you are deemed extremely medically vulnerable. You can take the form to a FEMA site or a pharmacy participating in the federal retail pharmacy program as a vaccination site. Currently, the Orange County Convention Center site that is run by the Florida Department of Health in Orange County is not available to the extremely medically vulnerable. However, our emergency manager has put in a request so that this may change in the future. In other words, we are asking the state for permission to also allow those who are medically vulnerable to be able to be receive the vaccine at the convention center. Now is really the time to get the vaccine for you and your family to meet the new guidelines. There are different brands, but they all provide the protection that you need. What I will tell you also, obviously, what changed today was that the president's executive order expanded to include, regardless of age, anyone who is employed by a K through 12 school. No longer is there a requirement that you have to be 50 years or old, of age or older. Now anyone working within the K through 12 school system is eligible to receive the vaccine. In addition, as a directive from the president, all states will open up vaccine eligibility to all educators and school staff, again, regardless of age. It is my understanding that Governor DeSantis will update his executive order soon, but already some pharmacies are administering shots to teachers of all ages. That's really good news for our community and for our teachers. Our vaccination rates are improving. To date, about 54.38% of Orange County seniors ages 65 and up have been given at least one dose of the COVID-19 vaccine. Nearly 10% of Orange County residents have now been vaccinated. The numbers that I have is 136,887 individuals, residents of Orange County, have been vaccinated. Since the start of the pandemic, there have been a reported 115,477 COVID-19 cases reported in Orange County. Sadly, 1,116 residents have died from the coronavirus. Ms. Hsu will talk more about the new cases, but I want to take this moment to remind our citizens, there's questions about whether or not we should keep the facial covering mandates in place here within the county. I think so, and the reason I say so is because people are still getting infected, number one. Number two, people are dying. And number three, we still have a long way to go to reach the herd immunity, to get up to that 79% pinnacle that you have heard Dr. Pino and others talk about, with us only being at about 10% of Orange County residents who have now been vaccinated. That means that we have 69% to go. That's going to take some months for us to get to that point. And until we get to at least 50% or so of our county population inoculated with both doses or with the new single dose of Johnson & Johnson, we're going to continue to leave our mask mandate in place. So I get asked that question all the time: will we relieve individuals are wearing masks? And at this point, the answer is no, not until we have substantially more people who are vaccinated within our community. There is some good news, though. The numbers are going in the right direction. Our 14-day rolling positivity rate continues to remain low. It is now 5.6%. Remember, the healthcare experts say that if you get to 5% or below, you have successfully contained the virus within your community. So kudos to our entire team effort here across the community, including the partnership between the federal government, the state, and our local healthcare providers, and our local Orange County and municipal partners in this effort. Our Barnett Park testing site will be open through the end of March. Our health services workers are there 7 days a week from 9 a.m. to 5 p.m. I say thank you to them for the vigilance in this effort. FEMA's large-scale vaccination site at Valencia's West Campus remains open. We want you to make sure that if you go to the Valencia site, the correct campus is the one, again, at 1800 South Kirkman Road, and not their other campuses. So it's the one at 1800 South Kirkman Road. For the Valencia site, pre-registration is encouraged but not required. As of early afternoon today, over 1,800 people have been vaccinated there. The site is open between the hours of 7 a.m. and 7 p.m. 7 days a week. Shots are also being given at our satellite location today at the Inglewood Neighborhood Center in East Orange County. That location is equipped to administer up to 500 doses. After that, vaccinations will take place at Kelly Park in the APOPKA area between the dates of March the 7th and 10th. That's starting this weekend through the 10th. It will be a drive-through site at Kelly Park. The satellite sites operate 9 a.m. until 5 p.m. You can get information about these sites at our website as well, ocfl.net/vaccine. There are still plenty of appointments available at the Orange County Convention Center. So again, to the eligible individuals, those 65 plus, and others who may be law enforcement officers, firefighters, or educators, they may make appointments at the Orange County Convention Center. If you're looking for an appointment, go to our website at ocfl.net/vaccine in order to register for the convention center. Seniors 65 and older who are unable to drive themselves to the FEMA vaccination site at Valencia College's West Campus may qualify for a free ride. Lynx is already offering the service, as you know, to the Orange County Convention Center. If you need information about getting one of the free rides, if you qualify to the Valencia site, all you have to do is dial 311, and we have trained our staff to be able to respond and assist you in linking up with Lynx. We only ask that you provide a 2-day notice in order to schedule your ride and have an appropriate day for your appointment. Orange County's Emergency Rental Assistance Program, again, was provided $33 million in federal funds to support residents who are at risk of being evicted due to COVID-19 financial hardships. Since we launched the program on Monday of this week, 2,149 applicants entered our online portal, and 934 applications have been completed. Our application portal remains open until the funds run out. Residents can go online. They can, if they don't have all the information when they initially began the application process, they are able to save it and go back and complete the form. You can get information from our webpage at ocfl.net/rental assistance for that program. And finally, as we continue to vaccinate our residents, my office has received many emails and letters and other kudos thanking the entire team for the efficiency of the process at the Orange County Convention Center and the efforts where our paramedics have been going out to into the community to inoculate people where they live. There was one person who provided a very sweet gesture, if you will, of thanks. You can see the photograph behind me. This very creative cookie made our paramedics smile, and we thought we would share the photo with you. Dozens of the cookies were given out to the healthcare workers who were out working to provide the vaccine to our community. So it is our pleasure to work hand in hand with the Department of Health and again, our municipalities in this effort. This is truly a community effort. And now I'm going to turn it over to Ms. Alvina Chu, the epidemiologist from the Orange County Department of Health.
Thank you. Thank you. As the Mayor mentioned previously, we've had greater than 115,000 positive cases reported to us. The current recovery rate is at 96%, and our 14-day rolling percent positivity rate is 5.6%. Unfortunately, since the last time we spoke, we've had an additional 12 deaths reported to us for a total of 1,116. To the families and friends of those lost to the virus, we extend our deepest sympathies. Unfortunately, those cases were 3 were female and 9 were male, 8 were non-Hispanic and 3 were Hispanic, 10 had known underlying health conditions, and 2 had no known underlying health conditions. The age ranged from 40 to 84 years old, and the median age was 79.5. I believe I had a question the last time about underlying conditions for the youngest death on our list, and yes, that person was known to have underlying comorbidities. The 12 dates of death are from February. 5 of the 12, or 42%, have been reported from a long-term care facility, a residential address. For variant cases, we remain at 17 of the B117 variant identified in Orange County residents. Their age ranges are from 15 to 61. 6 out of 17 were female, for 35%. 1 had known international travel, 10 had no known travel, and 8 of those 17 had known contact with a previously lab-confirmed case. The total doses administered for COVID-19 vaccine in Orange County are 259,214. Administered to Orange County residents is 222,364. The doses administered to Orange County residents who are 65 plus is 144,457. And the fully vaccinated Orange County residents is 85,477. So residents, Orange County residents who have received at least 1 dose of the vaccine so far is almost 10%. Of the 65 plus residents who have received at least 1 dose, it's greater than 50% at 54.38%. The FEMA COVID vaccinations, if you're interested in knowing, recently at the Valencia College West, for yesterday's totals, they vaccinated 1,841 doses administered. And at the Spoke at the Englewood Neighborhood Center, they administered 447 doses. Of these, 29 were the booster dose or the second shot. We've got plenty of vaccine appointments open at our Orange County Convention Center. The portal is open now, and we have appointments available for this weekend as well as open throughout all of next week. For those who are eligible, you can visit the CDR Health Pro website to create an account and schedule an appointment. And when you schedule that first appointment through that site, you'll automatically be registered for the second appointment for the second dose 21 days later. And to help us administer all of these vaccines, we'd like to let you all know that we're hiring COVID vaccination nurses and support staff for this effort. You could visit our website at www.orange.floridahealth.gov or GOV. Under the section for popular programs and service, there's a link for the COVID-19 nurse vaccinator recruitment. Download, complete, and submit the application to the email address that's listed on the website. We'd like to encourage you to continue to follow the pandemic precautions. As the mayor had mentioned, we are still working to vaccinate those in our community. As we increase the eligibility and as more vaccine is available to us and we increase the community immunity, we're in a race to try to get ahead of any variants and not lose any of the good grounds that we've made so far. So we'd like to encourage everyone to continue to practice the pandemic precautions, the basic ones, wearing a mask, watching your distance, and washing your hands. And with that, I'd be happy to answer any questions, and I'll turn it back to Mayor Demings.
All right, thank you. To the Spanish-speaking media, just as a reminder, we do have the ability to do translations. We have Commissioner Gomez-Cordero, who is here, and also Commissioner Uribe joined us, and we have my special assistant, Mr. Elia Torres, who can assist with that. We also have Mr. Scott Howard here from the Orange County Public Schools. If there are any questions for the school district, we will defer to them. And we have Mr. Tim Boldick, our compliance director, that is here as well. With that, we'll open it up to any questions at this time. All right, Ms. Lauren Seabrook.
And Mayor, my question's for you today. Lauren Seabrook, Channel 9. I want to follow up on your, when you were talking about the request to the state to try and inoculate people who are deemed medically vulnerable at the Orange County site. I know that there's going to be a lot of school employees that will be kind of maybe flooding the FEMA sites and the pharmacy sites, but we are seeing a lot lower numbers at the Orange County site. Does that play into your request, and how much of a chance do you think you have in getting this permission to be able to do that?
Well, obviously, the convention center, that is a state site, and it is only made possible through the inventory of a vaccine made available by the state, and so we kind of have to follow the state guidelines in that regard. That site is set up to be able to handle as many as 3,000 vaccinations a day, and we have been operating now below that number. So we want to really use the capacity that we have there to inoculate others within our community. So we put in a request to the state Department of Emergency Management to allow an adjustment to be made there. And so we hope to capture that additional capacity to allow others medically vulnerable to be able to come, who have the ability to be able to get into an automobile or be taken in an automobile to that location. The ultimate goal here is to increase the output of the number of individuals who are being vaccinated in our community. We're still working with the federal sites to ensure that we are doing outreach in the other underserved communities, primarily the minority communities. So we have spoke sites that are set up to do that, and then some other special outreach or community engagement things will continue to go on for the succeeding months to ensure that in the African American or the Hispanic community that we remove the current health care disparity with the numbers of individuals who are being vaccinated within our county. So we're working with our municipalities and others to make sure that everybody has equal access to getting vaccinated.
Channel 6, this question is also for you, Mayor. Last time we spoke, you said you had identified 9 locations to FEMA that you would like to see as satellite locations, with Inglewood and Kelly Park already being done on the 10th, and it's the 4th. Should we expect announcements for more of these locations? And also at that time you said you weren't given the 3-week forecast of what you would be receiving through the FEMA sites. Has there been any more updates with that as well?
I think the only additional sites that have been identified in inventory is related to the retail pharmacy outlets. You know, there's been some change there. And those are direct allocations that does not pull from our allocation here at the local level. So that is increasing significantly, so we look for improvement. In terms of the expansion to new sites, this weekend through the 10th, we will have the Kelly Park location. But I would make the assumption that tomorrow we'll come to some agreement with the state about where the next couple of spoke sites or satellite sites will be located. And we'll use the existing list and look at the inventory that is projected.
Melissa Thomas with Florida National News. You mentioned you would do additional outreach in terms of the underserved communities. Can you be a little bit more specific in terms of what that additional outreach looks like?
We will likely partner with places of worship, could be churches, locations like that, or other centers that are directly in communities where they have a high population of minorities that live within that area. And it's important to do the community engagement piece because in most cases, the registration or the communication about the availability of vaccine at those sites is one that is unique to that particular community. And you have to understand who the leadership in that community is and how the word spreads, and you need a little bit of time in order to be able to do that to be effective. So we have received numerous locations that have stepped up and volunteered to have the opportunity, and we have that list, and again, that will be tied to the available supply. And at this point, the supply is primarily being controlled by the federal government, with some of it being allocated to the state and then out into the local counties and cities. So we have a plan of action to be able to do that. So you should see announcements coming forward about some of those additional sites that will be small, closed pods that will exist coming forward in the next few days.
Kelsey Thord with West 2 News. My question is also for you, Mayor. You talked a little bit about the fact that we're seeing low vaccination rates at the Orange County Convention Center. We saw lower numbers at the FEMA site yesterday on its first day. Do you think that we should expand the criteria now, even broader, lower the age range so that more people have access? Or what do you think? I know that's a decision that's made at the state level, but do you think that they should make that decision soon?
Well, the decision has been made to expand, and at this point we have not had enough time to evaluate how that expanded population is going to impact the numbers. You know, the expansion today to anyone working on those K through 12 campuses. Prior to today, that number, it was 50 and above, 50 years old and above. But now it's anyone who works on those campuses. So we have to allow time now for those individuals to really get into the system, to either schedule appointments or to go to those sites to get vaccinated. So I believe that is going to take up some of the capacity, even with the law enforcement officers who are supposed to be 50 years old and above, or the firefighters who are 50 years old or above, who are included in the eligible criteria. Don't quite know yet what that capacity, what that's going to do to the capacity as well, and then to the medically vulnerable. The physicians have been given the discretion on making that determination. But there are probably lots of people who will fall into that category, and that will be regardless of age. So I think before you expand any further, we need to understand, we need to look at the data for probably the next week and see if we take up that capacity or not, and then make adjustments going forward. So we're communicating. Before I came down today, I participated in a conference call with the surrounding counties. Seminole, Orange, Osceola, and Lake counties was on the call, trying to understand, you know, a regional approach. And before that call, I was on a call with the National Association of Counties and the White House Intergovernmental Affairs Office, talking about these very issues as adjustments are being made across the nation. But we have heard the promise now that the supply is going to significantly be increased. And so we're making adjustments in our plan.
This question is for Scott. Danielle Lama with Fox 35. Could you give us an idea of how many OCPS employees are now eligible, and just the reaction today as this news has kind of been unfolding all morning?
So we were extremely excited to hear the news at noon when, or around noontime, when the governor had responded and said yes, he had confirmed that on the federal sites as a result of President Biden's guidance. So we were very excited. We got the information out as quickly as we could to our entire staff. We're looking at about 24,000 employees district-wide. We had about 9,500 that were 50 plus. So this will add those additional 15,000 to the pool. So we're just really excited that they're going to all have the opportunity to do it. And we've been putting messaging out around the Valencia location and the availability there, and also the spoke sites, Inglewood until Saturday, and then Kelly Park. So we're getting it out. They're excited, and we're excited for them to be able to get the vaccine. So thank you.
Okay. Next question is for Mayor Demings, coming from Danielle with WMFE. Mayor, what will it mean for local families that all eligible veterans of any age will be able to get vaccinated in the county, as there is such a high population of veterans who live in Central Florida?
You know, veterans are able to get vaccinated now through two sources primarily. We are fortunate to have a VA hospital here in our location, and if you are a veteran and you have your proper identification, you can go to the VA hospital and get vaccinated now, regardless of your age. In addition, all of the other sites that we have available, our veterans are able to go to those sites now. So I think that there's ample opportunity for veterans who want to be vaccinated here within the county. The VA hospital site, their inventory is totally different. It doesn't go through the state or any of that. So I'm well aware of many veterans who have availed themselves of the opportunity to get vaccinated at this point.
Great. I have another question for you coming from Channel 9, Alexa. What are you hoping to see at the FEMA APOPKA satellite site that opens this Sunday, as they are up in certain pockets of our county so critical for equitable vaccine distribution?
There's a lot of excitement, really, and I'm going to say vaccine confidence. We should see good numbers in that area. One of the reasons why we selected that area was based upon information received in our various offices about the need. In some cases, they had concern about traveling from the northwest part of the county all the way to the southwest part at the convention center. So it is going to be truly more convenient for those who live in that northwest quadrant, the APOPKA, Zellwood area, to be able to get vaccinated beginning this weekend if they so desire to do so. So what we're doing is we're working with the state to now be geographically dispersed in how we allocate the vaccine, but also to target some of the underserved communities to kind of improve the numbers of, in terms of disparities with black and brown communities.
And another question for you, Mayor Demings, and this is coming from Ryan Lynch with the Orlando Business Journal. What concerns, if any, do you have about DeSantis taking the same path as Texas and removing pandemic safety measures in the state?
I can read a lot into that question, but I presume he's talking about the removal of any type of mask mandates. Well, currently, there's no statewide mandate for the wearing of facial coverings or masks. They're strongly encouraged. The governor has not eliminated the ability of local governments to be able to control the circumstances that's kind of unique to their own communities. So we've had a mandatory facial covering order in place here since December, so 3-4 months now at this point. And so I'm, I can't imagine why the governor would do that at this point. If you look at the daily numbers of new cases, positive cases in Florida, and the number of new deaths, I don't think that would be an appropriate decision. So all that I can do as a local county mayor is communicate with the state about what I believe is important for public health and public safety in our community, and I'm going to continue to do that. But we're listening to the science, our healthcare experts. I will tell you today, we are on the regional conference call with the counties. We had representatives from Advent Health on that call, Orlando Health, and the HCA hospital systems were on the call, in addition to the health officers for each one of the counties. And they were all unanimous in saying that they would not recommend the removal of wearing or the requirement of wearing masks at this time. They were unanimous in that. So I can tell you that at least within the region, we're consistent in what we believe is the right thing for our region.
Great, thank you, Mayor. Mr. Howard, the last question is to you, coming from Bob Hazen with Wesh News. Do you have any numbers or percentages for how many OCPS staff has received at least one dose of the vaccine?
We don't. We actually had a closed pod. We knew back in January about over 300, but we don't track those vaccines. They could be out getting them on their own, so we don't have that number. So thank you.
Okay. That was the last question, huh? All right. Well, thank you for being here. Our next scheduled press conference is this coming Monday, and the 8th, I think it is, and that will be at the Convention Center, at the Orange County Convention Center at 11 a.m. So we're doing something different. We're going right into where the action is taking place here, so to speak, in our county. So we hope to see you on Monday at the press briefing at the Orange County Convention Center. Thank you, commissioners, for being here today.